Hello everybody, welcome to Sisterhood in Surgery. Today's June 15th. My name's Linda Lay and I'm at Houston Methodist, and my co-moderator is Palma Shaw. And today we'll be talking about the business side of medicine, building a practice. And our guests today are Leslie Lucchina and Julianne Stoughton, both from Boston. Welcome. Thank you so much for participating today. Leslie is a successful dermatologist in private practice who is also the founder and CEO of Lifeguard Skincare. And Julian is the assistant professor at Harvard Medical School and medical director of the Venus program at Mass General. And so today we're going to pick y'all's brains about, how you turn your clinical and medical passion into a successful business, just see your thoughts and how you got to where you are today. First question, when you completed your training and entered into dermatology and vascular surgery, how much exposure did you have towards the business side of what you're doing today? I mean, I know in medical school and residency, they teach you zero on billing and coding. I know SVS, from a vascular standpoint, does have a coding course you can pay to take, but other than that, coming out, you really have no base for a business side. And then Palma is going to school for her MBA, which she's doing on her own time. But anyway, thoughts from the three of y'all. Julianne, we'll start with
Why
you.
don't you start?
Yeah.
I had zero training, almost no clinical training in the office either, but so I never really got a chance to see what that whole half of the practice was all about. I think now our trainees do a lot more in the clinic, and they get to see how many staff members they need to do things, how much space they need. They do get to at least some of that exposure. I think business-wise, the first decisions that I had to make were totally blind, and it was more a matter of what job am I going to take. And they were offering me salaries everywhere from $75,000 to whatever, huge high and huge low salaries, but I didn't really understand any of the other benefits, stock options, buyouts, all these things that I didn't understand. So I had to really spend a lot of time learning from the lawyers in that situation. And then, getting into private practice, you just have to be really observant. I had to be very observant and kind of self-trained, but I didn't have anything, I think, when I was learning how to be a vascular surgeon. I was a good vascular surgeon, but I really didn't know anything about business at all. So I don't know, Leslie, did you?
Yes, well, we actually in residency did learn how to write the billing slips and codes, so that was done. And actually, when I finished my fellowship, I went to the Brigham and Women's Hospital in Boston because they were interested in starting a cosmetic and laser center. So I started the laser program at the Brigham and Women's Hospital, which still exists today. And so I was very fortunate to do a fellowship with Dr. Rox Anderson at the Massachusetts General Hospital in Boston. So I got a sense for what a complete laser center would look like. Of course, at MGH, it was complete clinical and research. So you had every device, anything new, anything that anybody was thinking about at your disposal. So when I went to the Brigham, I looked at my patient population and looked to see what their problems were, and I started from there. And remember, that was in the mid-1990s, so what was available then was very limited compared to now. So I started there by looking at my patient practice and then taking it from there. But I really felt like that having that background in my training, that really set me off on a very good footing for later.
I don't think in any of my training we had any exposure to that. When I took my first job at Boston University, I worked with Gary Gibbons, and he would always make me do my own coding. So I'd have my little sheet, and I eventually memorized all the repetitive codes that we would do for like debris mon or venous, whatever, phlebectomy. And then I memorized that, but I don't I don't know in academics you get any real insight into how they're running their practice. I'm not even sure if I really understand how they're running our department. When I look at the MBA, I was assigned to look at our books, and in looking at it, it's interesting how non-transparent these things can actually be. So I think the more we realize that we don't know enough, the more we have to work hard to fill those gaps in when we get finished.
Mm-hmm. Mm-hmm.
All good points. And Julianne, when did you feel that you had to take on the business aspects, cost revenue considerations when you started your private venous practice?
Well, my story has it almost has three parts to it. I had a spouse at that time that was coming to Boston to do a second residency. He was changing from OBGYN to anesthesia, so I had to come to Boston. There weren't a lot of jobs in Boston, and I took a job that was really in a community hospital system. It was a private practice job in general vascular surgery, and I really wanted to teach. I wanted to do maybe a little bit of outcomes stuff. I wasn't a real research person, but I had an interest in it. But I was getting a salary. I had to negotiate a good salary. When I got to that practice, I was told, well, this is what your budget is, and this is what your income has been, so we're going to go down on your salary, we're going to go, So I did start to become aware of the fee-for-service kind of insurance information and what was going on. I always tried to be very ethical about doing what I wanted, what I should do, and not what was going to be best for the practice. But I really didn't like that conflict so much in private practice, but I learned about it. And then I did decide, I guess we'll get into it later too, but I did decide that I was going to start my own business, leave the practice, and really that's when I really had to pay attention, and I had to learn about marketing and billing and cosmetic fees, and how do you collect things, and how many FTE. I didn't know what an FTE was. I didn't know how much a laser would cost, and how much you had to bill for a laser treatment, or how much an ultrasound costs, and how much you get for ultrasound with self-pay versus insurance. There are so many things to that. And then I ended up, so I did change over to the vein business, and I think I was very lucky, and it was an amazing transformation in my life, and then lots of really important, difficult decisions, but learning a lot about that, and then basically kind of having a lot of personal challenges in my personal life, and having to go back and figure out, I think I need to go back to academics, because I can't deal with this waiting for the income and trying to do all these QA measures, and it became very difficult in our field to keep going in private practice, and so I went back to it. So I had 3 different times where I had to learn a lot, but we'll get into that more later. Yeah.
And Leslie, can you go into a little bit more about how you focus on the business aspect of what you transitioned into?
Well, when I decided to go into private practice, that was a big decision for me. But once I decided that I didn't want to be a full professor at the medical school, it was very easy for me to then move on and start my practice. And I was very fortunate, because there was a wonderful office space on Commonwealth Avenue, close to where we lived. So it seemed like a natural fit. So actually how I put my practice together was I looked at my patient population, and I knew what I knew how to do, and I just took it from there. It really wasn't that complicated. What it was getting up every day and going to work. And the more patients you see, the more patients you see as it goes. So I kind of just got to work. It was very,
you have insurance?
So I have always taken insurance, because I'm a board certified dermatologist, and we spend, I trained for 9 years. I trained in medicine, and then I spent some time in the lab, and then I did my dermatology residency, and then I did my fellowship. So I was a very well-trained internist and dermatologist, so I've always taken insurance, even now. And even when you come to see me for something as simple as a Botox treatment or a peel, you know, I will look at the whole picture, and you don't just get that. You have me examining you and taking a full history, and I often encourage people at that visit to take, to do a full skin check, but if not, we'll do it at a follow-up. But I've always done that along the way because it's just part of the package for what I do.
And that's why all your patients love you.
Well, I think that patients don't really want to see multiple doctors. They want to come in, they want to come into the office. And you know, I don't want to be that patient. I don't want to be that doctor that does Botox on somebody and missed the melanoma on their back. You know, that is not good. So I think it's good to make sure that everybody's healthy and taken care of from a dermatology point of view before you embark on down the other road of the cosmetic part.
How did you how did you create your own skincare line and then transform that into part of your business?
Yeah, so what happened with that is I kept getting asked what should I be buying, what am I, you know, and when stores such as Sephora became very popular, I would say to people, well, bring in everything you have, let me look at what you have. And people would bring in shopping bags full of stuff that they'd spent a lot of money on, none of which, a lot of it wasn't really what they needed to be using, but they spent so. And you know, I always tell people, you can start with the easiest thing you can do is take care of your skin every day. I can do, you know, certain procedures for you. I can send you to one of the surgeons if you need I can do many things for you, but you really have, you know, every day you should take care of your skin. So it started out kind of like that, where I felt like, okay, people need to be using the right thing. So I embarked on looking at the science and deciding what things really made a difference in the scientific literature. And then I went from there. And you know, when I first started doing this, really there were only companies in the department stores and a few in the drug stores. And then a few more medical grade dermatology products became available. And when that started in the 90s, and obviously since then it's really taken off, but I've stayed very focused on certain ingredients that we know that make a difference and putting them in different vehicles that people like, so they'll use them. And trying to keep people very focused on the things that they can do on a daily basis just to take care of their skin. So, and people say, well, so how did you make that grow? And in my practice right now, I have about 5,500 patients, probably 80% women, and most of my patients are looking for ways to take care of their skin, so it was a natural fit.
Wow.
So how would you say that you've maintained a competitive advantage? I would say changing from the early 2000s till now, where, you know, media and a lot of things are on the internet, and it's a whole different way of marketing yourself and kind of keeping ahead of the next person. I think each of you has had a very unique, you're really pioneers actually. Julianne, I know, is a pioneer. I mean, she was building a Venus independent practice when nobody was doing that, and she was, incredibly successful in doing so and maintained an academic bent on that as well. So she's done it well, and I think that Leslie, also, you've really done something quite different. I mean, it takes a lot of bravery to actually do that. But now, how do you stay ahead? Now that you're there, how do you keep ahead of your competition?
Well, I think that following the science definitely is the thing to do, because, you know, and that's how I started out. And I really think following the science to see what, you know, to try to stay on top of what's new, what's happening, technology, that's a big part of it. But I also, you know, my office is one block away from Newbury Street in Boston. I'm on Commonwealth Avenue, and on Newbury Street, you know, there's no fewer than probably 50 to 100 places where you can go and have multiple skincare treatments, from anything from just a facial to very significant laser treatment. And so people ask me how I manage that. And you know, I can't manage other people, I can only manage myself. So I think that putting myself out there is who I am, which is I'm a board certified dermatologist and I'm a doctor. I'm not a technician. I'm not an injector. You know, I'm sort of the whole package, and I'm going to look at you from, you know, every vantage point to give you what I think you need. And if you don't need anything, then you don't need anything. But, you know, I'm not, that's how I look at this, that I really can't control sort of the other things that are out there. I have to stay focused on what I have to offer.
That's pretty brave. I also, you know, started to sell stockings in my office, but they weren't stockings that I designed. I had to get companies to come and give me a good price so that we could sell them to the patients for less than the stores, whatever. But I had a few ideas on inventions, and I'm just fascinated because I talked to the manufacturers and they'd say, no, it costs too much, it's not going to be selling enough, and we don't suggest it. I had a couple of patent ideas, couldn't get those off the ground either. And I'm really surprised, I'm just sort of in awe of how you seem to have made it easy to have a product, and you just got a compounding pharmacy, and did you get legal help or patent help, or how did you know how to do that?
So, well, you know, it's a lot it's a lot of groundwork. It's a lot of groundwork to put it together. But I really, you know, it's a lot of time and it's a lot of effort is what it is, basically. And, you know, as my daughter was getting older, I had more time to sit down because there's only 24 hours. I tell people all the time, there's only 24 hours in a day, and you have to decide how you want to spend those. Mm-hmm. And at different points in your life, you have more time than others. You know, so people say, you know, wow, you know, you built this practice and you have this beautiful office, but, you know, that's hours of sweat equity, right?
Mm-hmm. Right.
A lot of, I mean, it's a lot of effort, and it doesn't, you know, it's you know, it's just sitting down and it's getting it done, and you should not be in awe or brave. It's something that everybody can do. It's the time, you know, that it takes to make it happen.
What were y'all's biggest obstacles in creating your private practice and keeping it successful over the years? Julianne?
Yeah, there were obstacles all along the way, really. I think that I guess the biggest risk that I took, and probably the reason why I was asked to kind of help to share some of my story, the biggest transition that I made was when I gave up the routine. I had a pretty good vascular surgery job, and I gave it all up and took this risk and went on to the vein practice. And the biggest obstacle was, again, not having been trained and not having an MBA or any really prior experience. I think now our residents know a little more, but in the 80s to the 90s, it was not something that we learned. So it was just, you know, at first I thought, how am I going to finance a practice? How am I going to buy this equipment and pay my employees and be able to collect money from, you know, and who do I need on my team? And I think the team building was probably one of the things that I did early on that made the most success for me. Was I found an amazing sort of diamond in the rough office manager who, you know, had an associate's degree, but she was incredibly organized, and she really complemented what I didn't want to do. So she could really do a lot of research on things and find the right banks that might give us loans and find the right ultrasounds that would be you know, compatible with what we needed, but not too expensive. And should we lease it or should we buy it? That kind of thing. But the obstacles, I think, were the initial financing, which I did eventually get an SBA loan, and again, sweat equity. I had no income really from the practice for about 2 years. I just kind of, everything I made, I just paid everybody else and paid off my equipment. But then I started to get the bonuses at the end of the year as we were making more, and then you know, the rest was good. And I think other obstacles, certainly, where do you get the patients? I think again, I was very lucky that the word of mouth just spread like crazy. Again, I was very different as a female. So people maybe didn't like that at first, but I just kept on hanging in there. So I'm not going to be embarrassed about who I am or what I'm doing. I'm a vascular surgeon, but I'm going to be a vein expert, and this is what I do, and I love it. And if you want to come and do it, this is great. And that's how I think that obstacle really went away pretty fast. And I started being asked to give talks, and I started running conferences on veins and trying to teach others. And all of a sudden, I became a leader with something that I thought was really an obstacle. It turned out to be a benefit. And I guess that I'll stop talking there.
So we just want to see if anybody in the audience wants to call in any questions that they'd like either of our guests to answer. They should send them in now. Be good. So I think in 2020 we've had a rough year coming out of this pandemic, and I think a lot of things are going to change. I don't think we're ever going to really be back where we were a year ago. We're not that naive anymore, right? So I think from a business strategy perspective, I think we have to regroup and really realign our strategy. I agree with you, Julianne, that the team is critical. Establishing a very good team that you can grow with and can challenge you and actually disagree with you and help you find a better strategy is very important. And I think it would be helpful to know what you, both very successful women running your practices, how are you positioning yourselves for the future? Have you realigned or changed your strategy about how things are going to go forward? How do you envision things evolving over the next 5 years?
Leslie,
have you thought of that?
Yeah. Well, I haven't thought about 5 years from now. Right now, we're kind of in the moment because we're in the middle of this pandemic and things are Boston, Massachusetts has been hit very hard, along with New York and New Jersey. So we're probably going to be at least in the literature, if you read, it seems as though we're going to be slower to come out of this. So right now, initially, many of us we're still sort of in survival mode. But remember, through this time, we all have to change how we run our practice. So for instance, going from a practice where I'm literally going from room to room, now I have one patient every half hour. So starting at 8:30 in the morning until I finish. So it's one patient every half hour, and so the patients don't see any other patients. The rooms are cleaned in between, which I did anyway before, but now you do the door handle. Now you do where the patient hung their clothes. Now you do the chair that they possibly sat in, right? So you do that, and then you clean the chair that they might have sat in by the assistant. And so there's a little more to do. So there's going to be less, my volume will be down for sure. And every day it's a little more challenging in that people are a little more anxious about what's been going on and also what's happening now. So the days are a little longer and they're taking a little more energy out of the day, just in general, trying to reassure people. And of course, everybody's wearing a mask. And so there's a lot of different things right now. I have always kept financially, I've always kept a very tight practice, so no waste. And I've replaced equipment when it needed to be. And, my assistant will tell you, if you look at the books, it's very lean, and I've always kept it that way, and I'm always a planner, and I always figured to have some reserve. I never thought that we'd have a pandemic where my income would go to zero overnight. That was something. So, but we're working our way out of it now in various ways, and you're right, it'll take a long time to get back to where we were, without question.
But Leslie, I just want to ask, so, you do have this skincare line, right? And you
Yes.
sell that. So clearly, this is a part where maybe your clinical volume is at a low, but you can focus more on expanding the online marketing of your products.
So we are online, and lots of times though patients will call and ask for recommendations. So I've done a lot of product sales, but remember, if your income is dropped, you're not exactly looking to buy an expensive moisturizer. You're looking to keep the price point down, which we have I have price points from I have products at all price points. But yes, without question, And that will definitely be something that'll sort of be as my father-in-law, who was a surgeon, the pot boiling on the back of the stove, you know, the simple things that he did in his surgery practice to keep it going. So for me, yes, that's simple things, but also the skincare line. But, you know, you have to remember the unemployment rate is about, 25%. So you have to figure that in as well. And I think people are probably feeling like they want to keep things a little more lean right now until they can figure out what's happening.
Although you could expand your market, you could go more globally. I mean, is that, you know, through advertising, through your website, you know, through different marketing venues, you may actually take this time to expand your market beyond your current scope of marketing.
Yes. Yes, and that's something that, you know, we have started to talk about, in the sense that if I'm only going to be working 4 days a week instead of 5 days a week while the pandemic is happening, then that's something that we've talked about in a way to, because we'll have more time to sit down and plan that out. So we've talked about that.
Julianne, how do you think you'll pivot? I mean, how are you going to pull out of this? Do you have any tricks up your sleeve?
Yeah, well, it's definitely made me look at my practice as a whole. And over the years, I became so successful and so busy, and my schedule would be booked out at least 7, 8, 10 months sometimes without any openings. And I had people on wait lists, and I'd lose a lot of patients. And I started to realize that, and again, in this pandemic, I did a lot of virtual visits, and started to realize that a lot of my practice, a lot of my time was not just doing procedures, but it was also following up and following up and following up. And some of the smaller procedures, like a cosmetic sclerotherapy, which is, you know, RVU wise, or, you know, cost wise is a tenth of what I would make, you know, if I was doing an ablation procedure in the same amount of time. So I'm looking at the practice and saying, you know, what's really crucial. And we had to triage so many people that it made me really think about. I think that the use of paraprofessionals, you know, nurse practitioners, PAs, even RNs, I think that we're going to have to get into a place where we can have the follow-ups, for instance, seeing one of them and having a screening for, are they symptomatic? Are they having pain? Do they have any complications that they need to see me? Otherwise, my time is going to be mostly, I think, doing some of the more, you know, the other procedures. And I think that's just what we're going to have to do to pivot. And I became almost like a primary care doc of vascular, you know, even arterial patients, they'd come in and see me and tell me about their complication, and, you know, and I'd be like, have you stopped smoking? And, you know, are you doing this? What's your cholesterol, blah, blah, blah. So I'm now getting to that point where I think I'm going to have to do less vascular medicine and more vascular surgery, and let the others, you know, fill in those gaps for the patients that don't really need to see me. I think that's going to be my way of doing it. It's been tough.
I think Linda can comment, although I think she's been maternity leave through most of this. But in our group, I think what we're going to do is a bit of a hybrid. So I really think that these NPs or PAs can be on the front line. I mean, any of them can screen for aching legs, prescribe the stockings, order the reflux study via telehealth. You know what I mean? And then the next visit could be me. I mean, the bottom line is that I should be in there making the decision about booking the case and sealing the deal. And they should be teeing it up, and then subsequently we should be available for any concerning complications or problems or anything subsequently. But a lot of this can be managed from telehealth. I did 12 telehealth visits today, you know, and not one of the patients had a surgery that had to be booked. So I saw twice as many patients, and I was much more efficient than actually waiting to see them in the office. So I think we just have to sit down and deal with this adversity and recreate ourselves.
Yeah. We're also making training videos for patients, because really I start feeling like a broken record on the telehealth, and I'm telling them the same thing. I feel like they could be watching that, you know, offline.
Linda, what are they down? Alan's making some videos. Have you been getting updated about what you're doing down in Houston?
Well, I think we've been one of the, even before COVID, we were on the, frontier of doing videos, right? Our ORs here all have built-in video cameras, and the technology that we have to make videos, webinars. I'm sitting in our own studio, with our own studio crew. So, I think for Methodist, we're definitely ahead of the game on how to do it, videos and webinars and, Zoom conference calls for sure. But yeah, we've been doing how to do it videos, and I think we're just going to get better over time. New ideas are always coming into play. In fact, pre-intern, our boot camp for trainees got canceled because of the COVID situation, and so we've had the Zoom meetings for that. So they're still doing hands-on via the camera, and they've even had a Zoom karaoke. I'm not sure if that's on YouTube, if Alan has circulated that amongst the vascular surgeons, but
I think he sang it the one time.
Yes, he sang. There was singing and dancing actually, and it was to the Beatles song. What was that song?
Yeah, they redid the words to it.
Yes, so they redid the words to it. So it's actually hilarious. But yeah, so we're pretty on top of the game here, I would say. And so the last question, kind of for this episode, on a personal note, how do you balance, especially both of y'all's, the sweat equity, the time you put into your business? How did you balance that with family, with friends, with, your hobbies that you also wanted to do, and time management for that?
Julianne, do you want to take this first?
I guess I can. I was fortunate, but maybe a little crazy, to have 3 children. I had one in my lab year of fellowship, one after my training, right as I was a new attending, and then one later on as I was an attending. I think that doing this business, it was so that I could be home more, because I didn't have as much arterial calls. So that was good, because I wasn't getting called for a ruptured AAA when I was in the middle of their bath, or, trying to read them a story when they're going to sleep at night. Then they'd have nightmares because mommy had to go because somebody was bleeding, So it was a good thing in some ways for them that I had the vein practice where I could come home. But it was a lot of, after they got to bed, staying up and looking at the budgets and checking out is Blue Cross paying us enough, and how are we going to get these stockings done, and various business decisions and marketing things I'd have to do after hours. I think also one of the things, all of us probably, I think now you're a mom too, balancing and trying to have the organization of your childcare, or having family members or something that you can really trust and count on, really is essential before you can do what you need to do. Sorry about that background noise. You have to have that backup and that support. I'm going to move. I'm sorry, got construction going on outside. So have to have that background. And I think that my challenge was just making sure I had 2 nannies that were alternating time, so that I could make sure that I could do what I needed to do. Sorry, go ahead.
Good advice. So I need 2 nannies. Okay. Leslie, what about you?
Well, our daughter was born when I was a 3rd-year dermatology resident, and my husband was in his 2nd year of cardiothoracic surgery training. So we had a very busy household initially, and then I became a laser fellow right after that. So it was just very, busy time for both of us. But I think over the years, most of my patients and people who know me knew that my family was my first priority. And I did everything I could at work, and then I would bring home whatever I couldn't finish. And after Caroline was asleep, I finished it up. And I think that for those of us in medicine who work very hard, regardless of whether you have a business or regardless of whether you work part-time. The one thing that you give up when you work full-time and you have a family is having friends to do things with, their friends who are your age, or because there's just no free time. So, when you hear that your peripheral group are out during the week and they're doing things together, they're going out on the weekends. On the weekends, we pretty much stay together as a family, and we've always done that. And so we were kind of our own group as a family. But you realize as you get older, and as Caroline got older and she had her own friends and went off to college, that you kind of reconnect with people. But that is one thing that you really give up when you're working full time, is that part of it. And then of course all those things that people call hobbies, those have come back into play over time. But I just really prioritized my family and my work first, and then if I had any free time, it kind of went from there.
I just started watercolor painting during this whole thing, and I love it, and I'm going to keep going. It's pretty cool.
I think hobbies are a thing of the past when you have younger kids, because my only hobby right now is work. And just trying to survive and keep the kids intact. And my mother helps me, and I'm a single mom. And, I think hobbies are a luxury, and I think we just get through it. But it's well worth having the career, having the kids. And it's really important to have other friends that when you feel like, I don't know if I can do this, they're like, of course you can. Like, the more you fall down, the faster you get up, and they motivate you. And sometimes Linda and I, we give each other little pep talks sometimes.
Yeah, for sure. Yeah. I mean, it's, my friend, like I may not do many activities with my friends, but, I talk to my best friend in DC, and even that, it gives me that feeling of, like I do have, friends around me, and we may not be going out to dinner or drinking, but they're definitely there to support me. And my hobby is eating, which I always have had time to do that. So, but yeah, so definitely now, I mean, even before, family was always first for me, but now that I've had Ella, I mean, it's like a love you can't even imagine. So, which all of y'all feel because y'all are all moms. So it's definitely a new thing for me, but I enjoy every day with her.
Either of you have last comments you want to make? It's been amazing what you've contributed. I don't think you would even recognize how valuable it is, all the things that you've discussed today, and how much it's going to mean to young trainees and medical students. And I mean, they should all be watching this. So it'll be on DeBakey Live, YouTube, and for many more people to see. But if you have any other comments, that'd be great to wrap it up.
I just want to thank you both for asking me to be here. I'm really happy to meet Leslie. We have actually some patients in common that I've never met, and I'm in awe of what you've done with your business side of things. And I think that I would say, be yourself, follow your gut, and get good support around you. Don't be afraid to take risks. If you fail, you've learned something from the failure, and you go on and try again. And if you win, then you become, something fantastic. But you do have to keep on looking at the future and readjusting. And I think that's something else to be aware. And I think paying it forward. I try to pay it forward to my residents, and male and female. I just try to say, you need to know about this. You need to know about the insurances and what isn't covered, and how you get your staff to be happy, and all the HR stuff that I didn't know and learned over there. So just those are my last words, I guess.
Leslie, any last?
Yeah, I would completely agree with that. I think, what's that? I think that you're up. Oh no.
You're breaking.
Do you have me on?
Okay, you're back.
We breaking up?
No, you're good now.
My back?
Okay.
I think what Julianne said is really, I think staying true to yourself is really important. And I think that don't get sidelined by what other people are doing. If you like what you're doing and you're good at it, and every day you get up and you look forward to going to work, that's really important. And don't be intimidated, or don't go down a path which really isn't for you. And I know that we feel like you want you look at other practices or you look at other businesses and you think that you know might be something that you could add in, and you really think about it. But just being true to really who you are is really, to me, the most important thing that's been my kind of what's guided me through all this.
Great advice from 3 wonderful, successful, beautiful women. And so that wraps this webcast today. Thank you for joining us. We appreciate everything that you've done for women in surgery and what you're going to do in the future.
Thanks.
Thank
Thank you very
you.
much.
Thank you. Take care.
Thanks.
Thank you, Linda.
Good luck to everybody.